Still to come this afternoon, a flu vaccine warning after one of the worst flu seasons on record.
A physician is joining us here in the studio to share what you need to know to stay healthy this winter when we return. In today's Health Smart, we are talking about flu season and how you can protect yourself and your family.
Joining us this afternoon is Dr. Nicholas Testa, Chief Physician Executive at Dignity Health, Southern California. Good afternoon.
Good afternoon.
Good to see you.
Thank you.
Okay, so you've been here before. We've talked about how serious the flu is. Last year was a big deal.
Last year was a bad year. So last year we saw more deaths from the flu than we've seen in 15 years. 80,000 deaths from pneumonia and flu illnesses. 180 pediatric deaths. That's more than we've seen. 171, I think, was the most they've seen, but never that high.
And what do you attest that to?
So last year was a particularly bad strain of the flu. So there's different kinds of flu viruses, and last year we had the H3N2, which is a very virulent strain of the flu. But the other element of it is also we're still seeing under-vaccination. Only, I think the number was 155 million units of flu vaccine shipped. That's only 48% of the country. So we're still under-vaccinating.
So those who got the flu shot last year, it was not perfectly right for the actual flu that showed
So
up.
when they prepare the flu shot, they have to do it months in advance, and the flu mutates over time. So it wasn't a perfect flu vaccine, but it still prevented quite a few cases. So when they can model it retrospectively, it prevented about 5 million cases. This year's flu vaccine looks at what occurred last year and then incorporates that strain into it. So it should have more efficacy this year.
So we've learned our lessons. What's going to be different with the
Exactly.
vaccine this year?
So they've really ramped up the H3N2 prevention. Now, it can still mutate again, right? So it's never perfect, but it still prevented a tremendous number of fatalities. So the key thing, though, is getting that vaccine early, because it takes about 2 weeks. So we want to see people get it in October and November.
There are still people out there, though. The V word is considered bad for some. As a physician, as a medical expert, the vaccine is a good thing. You should get a vaccine.
Absolutely. We don't remember the flus that we didn't get, right? And that's because if you got vaccinated against it, it prevented it, right? So the vaccine is the best way to prevent it.
And then what about the needleless vaccines?
So the CDC this year is making the first real recommendation around the needleless vaccine, which is a live attenuated virus. So it's the actual virus. It's just mitigated, so it won't actually cause the illness. For patients who are 2 years old to 49 years old, who aren't pregnant, and who have no other illnesses. Again, it's not perfect, but it's another option to increase those vaccination rates.
Okay.
All about reducing those rates, right?
Yes, exactly.
Yeah.
You don't want to get the flu.
Yeah. Increasing those rates.
Yeah, right. There you go.
Increasing
them, yeah.
All right.
Well,
thank
thanks so
you
much.
Guys, thanks so much
for
for
coming
having me,
in.
as always.
Yep.
Have a great day.
Sure, we'll see you soon, and we'll be right back.
Robins sing in December, long before the